Hello, this is Alan Bienstock, and I'm a board-certified and plastic reconstructive surgeon. I'm here to give you another exciting installment of how to manage your loved one in the home and how to deal with wound care. So one of the biggest questions I always get is, how do you prevent wounds so you won't have to get someone like me to come to your house? This is an amazing and difficult question at the same time. In terms of prevention, the most important thing is if your loved one can ambulate, is to get them up as frequently as possible and not have them sit or lay in the bed. If this is not feasible and they have decreased ambulation and or they're bedbound, then you have to make sure they're being turned and repositioned. Well, what does turning and repositioning mean? It means you can't have them laying or sitting in the same spot. Unfortunately, with a lot of my patients who are religious, they tend to like to go to their house of worship, whether it be a synagogue or church, and they're sitting in a chair for several hours, which puts enormous pressure on what we call the buttocks, and they get what's called an ischial ulcer or a buttock ulcer. Another issue are patients that are bedbound that get a sacral ulcer, or this is a wound at the tailbone. And this is due to the fact that there's unmitigated pressure on this area. So to prevent these from happening, your loved one has to be repositioned. If you're sitting in a position for a long period of time, you're knocking the blood flow off and decreasing the blood flow, which can lead to what we call necrosis or death of the tissue. So back to the premise is in terms of prevention, we have to make sure that your loved one is being repositioned. So at nighttime, they have to be turned from hip to hip every 2 to 3 hours. Even if you're on the hip, you can still get a pressure ulcer, which means that if you're by yourself and your husband or wife, you're taking care of your loved one, that means every few hours you have to get up to turn them. If you're trying to prevent a sacral ulcer from developing, you can actually get a hip ulcer if you're not switching positions on the hips as well. In terms of sitting in a wheelchair or another chair, you have to make sure the patient's being repositioned or loved one's being repositioned. Meaning if they're sitting in a chair for an hour and a half to 2 hours, you have to either put them down on a couch or switch them to a bed or switch the position of the chair if it's a wheelchair. These are very important things. It's not like we want to have your loved one in bed all the time, which can decrease their quality of life. You want them to be able to enjoy themselves, but you also don't want them to get a pressure ulcer, which can become either a stage 3 or stage 4 ulcer, which becomes very deep and can lead to an infection and then create more problems in terms of quality of life. So there's a brief summary of how to prevent ulcers. I would appreciate if you could subscribe to our channel below or in the middle, and I look forward to our next episode.